give us a little bit more material in approximally and up along the crown of the tooth. Okay, and then we go back. Close. Nice and tight. Open, close, bite down nice and tight, and open. Okay, chill it in. Again, simply the reverse. If the desire was to provide a less retentive fit, we would just warm up the appliance in application, open and close, and open and close over and over again. We could loosen it up. The nice thing about the thermoplastic is that you are in complete control over the retention of the material, over retention of the appliance. You can make it looser, you can make it tighter, you can smooth it with your finger, you can change position readily. So if we wanted to change position, we would do the same thing. We warm up to the top, we use a different bite gauge, and go into a different position. And I can illustrate that as well. So I'll put this back on. And close. Okay, and open. Okay, and a lot harder. So that is more retentive now. Let's go ahead and quickly show how we would change the position. So again, this is our end-to-end position. And let's say the patient comes back and they are still reporting snoring, so we are going to change this position. Again, just to do this the quickest way possible, we don't need to warm up the lower, we just need to modify the maxillary portion. I'm going to warm that up a bit. Hold that in there about 10 or 15 seconds. Okay, you can see that warming up. I'm going to kind of squish the material in there. Okay, I'll warm that up a little bit longer. I'm going to basically get it back to the state that it was in when we first fit it, or when we fit the initial position. Okay, that's basically all soft again. That probably took about 30 or 40 seconds. We're going to use our different bite gauge. This would be the +2 bite gauge. So we've decided to go forward a little bit. We go back now. Fit it on the lower teeth. It still snaps on the lower teeth. And now we put our different bite gauge in, close, which comes forward a little bit. There we go, and finds the position. So now we're in that new position. Good. Tongue forward, lips around, closed. Okay, good. Alright, and open. Good, and go ahead and open your mouth. Carefully remove it, not to bump that material against the upper teeth. Okay, now I can show that. One word of warning with the thermoplastic, again, it is very retentive, or can be very retentive. You want to make sure that you explain to your patients that they're not going to want to do this procedure at home. They should not be warming up their own appliance and fitting it themselves. Okay, and that is properly chilled now. One of the nice features also of the thermoplastic is we have a very aesthetic looking appliance when we're done here with the white thermoplastic and the clear silent sleep tray. And close. Back down hard. There you go. And that's the spot. So now that's a couple of millimeters forward. Have the patient feel around with your tongue, your lips, your cheeks. See if there's any place rough or pokey. You find any place rough or pokey? No? Okay, open. If she had said that she had found any place, we can usually have those pointed out to us and simply warm up the area and smooth it out with your finger. But again, this is very, very smooth. It's aesthetically pleasing. It's hard, so this material now at room temperature is very, very hard. There is no way that that is going to separate out of the tray without serious effort to remove it. With changing the position, we can easily warm it up as shown and change the position. Also, over time, if required, one could remove the material and reline it with brand new thermoplastic beads if that was the desire. So, again, that's how to use the thermoplastic bead method of fitting the silent sleep. I hope that that you enjoyed that tutorial and that the thermoplastic beads will be a method that you'll use quite a bit with your patients.